A lot of people don't realize there's so many layers behind the use of contraception, what it means.
Every day is a contraception day.
Personally, contraception has been life-shaping.
But exactly what the UNFPA does.
So United Nations Population Fund, UNFPA, it's the UN's Sexual Reproductive Health Agency.
When it comes to family planning, it is her choice.
Absolutely.
And it is her body.
If a girl is married, they expect her to have a baby the same year. There's so much pressure.
Still very much a taboo subject.
Girls and women are able to complete their education, become financially independent. They are not just transforming their own lives, it's their family, society and the country.
I do like the idea of a woman having the power.
And Indian people need it definitely.
So what is the mortality rate at the moment?
We were 500 plus 4 decades ago. We have come down to now 80. Our concept is every pregnancy should be planned, right?
India is home to over 1.4 billion people. That is the largest population in the world today. A remarkable 50% of this population is actually under the age of 25. And that means India is a global leader in youth demographics. With such a young population and so many dreams tied to their future, conversations around family planning and reproductive health become even more important. Contraception is not just about preventing pregnancy. It's about giving women control over their lives, their education, their careers, and their well-being. On this special episode of All About Her, in partnership with UNFPA India, we are marking World Contraception Day by discussing why access to contraception matters, what myths and challenges still surround it, and how we can build a future where every woman and every couple has the right to make informed choices. UNFPA, or the United Nations Population Fund, works to ensure that every pregnancy is wanted, every childbirth is safe, and that every young person can reach their full potential. I've joined hands with UNFPA India because I truly believe in their mission and I do want to help amplify it. Hello and welcome to All About Her, a space where we have honest and meaningful conversations about women's health, wellness, happiness, motherhood, and self-care. And today, we are discussing the importance of contraception and reproductive health. We have two incredible guests with us today. Joining me is someone whose work has directly impacted thousands of women, helping them to make informed choices about their health and family planning. India's leading gynecologist and obstetrician, Dr. Sunita Tandulwadkar, president of FOGSI and a true pioneer in women's reproductive health. And alongside her, someone whose voice has reached millions and who is passionate about raising awareness around women's health and empowerment. Please welcome Dr. Deepa Prasad, Chief of Programs and Technical Support at UNFPA India, who has been at the forefront of shaping policies and programs around reproductive health and rights in the country. So thank you so much, Dr. Deepa, Dr. Sunita, for being here today. We're speaking about something that is very important and timely. And I wanted to ask you both, starting with you, Dr. Deepa, if there's World Yoga Day, there's World Children Day. There's also World Contraception Day. So why is that day so important?
Thank you, Soha, for having me on this show. I'm really delighted to be here, and especially today where you picked up a very important topic. It's on contraception. For me personally, contraception has been life-shaping. As a mother of 2 daughters, having to manage career, family, and my passion, when I look back, I feel that contraception has played a very critical role. I got married when I was still studying. And I was lucky because I was pursuing my medicine. I was doing my OBGYN course. And then I was aware of what is the best contraceptive for me. And I had support of my family, my husband, Raghu. So all of it worked for me. And I've been fairly able to balance family and my career. Right. But that's not the reality for a large number of women across the world and in India. If you look at just numbers in India, that's mind-boggling. So, there's something called unmet need for family planning or unmet need for contraception. And if you look at it in absolute numbers, about 4.7 crore women have an unmet need in India currently.
Really?
Yeah. And contraception is not just about preventing pregnancies. It's much beyond that.
Yes.
It's an enabler. It can empower women. It can give them opportunities when women know what is best for them. And World Contraception Day is significant because it is to remind us that contraception plays a very central role in development, not just for a woman to plan her family, but beyond that, for the society, for the family, etc. It's also to remind us that family planning and contraception is a right of every woman. It's not that somebody would decide for her. Yeah. It's also to remind us that there is a right for everyone to decide on whether to have children, how many to have, and when to have.
Right.
And therefore, the importance of World Contraception.
I think a lot of people don't realize there's so many layers behind the use of contraception, what it means beyond just preventing having children, perhaps.
Absolutely.
Dr. Sunita, I wanted to ask you the same question just to start the podcast.
My opinion is completely different. You are asking why 26 September as a World Contraception Day. It's not only for a contraception day, but Mother's Day also, Father's Day also. I don't think one day we should be celebrating as a contraception. Yeah. Every day is a contraception day. That should be the reality. But probably we like to celebrate one day just to remind the people that there exists the contraception, because if we don't speak so loudly, because every day we will not be talking about contraception, so we need to choose one day to speak about so that it reminds. Then it should be every month 26, let's celebrate as a contraception day, so it will be reminded more and more, and Indian people need it definitely.
I want to get into what all Indian people need absolutely in this. I wanted to touch on, a lot of people, of course, are familiar with the United Nations, but exactly what the UNFPA does, especially in terms of family planning, reproductive rights and health for women in India and globally. Can you tell us briefly about how exactly they work?
So United Nations Population Fund, for short, UNFPA, it's the UN Sexual Reproductive Health Agency. Our mandate upholds the fundamental human right of women's sexual reproductive health. We have a mission which is very simple, but yet profound. It's about a world where every pregnancy is wanted, which means there are no unintended pregnancies. Every childbirth is safe, which means no woman should die giving birth. And every young person's potential is realized. Yes. So that's our mission. And if I have to break down a little, we work on family planning. We work on safe motherhood initiatives. We have a lot of interventions to build skills of young people, providing them information and providing and building their life skills so that they are able to realize their full potential. In India, we work very closely with the government, of course, in most countries, and also with various stakeholders who are...
Also with FOGSI.
Yes, definitely. All the stakeholders, the private sector, FOGSI is a great partner to us, several other non-governmental organizations who are in the space of enhancing access to sexual and reproductive health. Mm-hmm. While this is a major part of our work, we also work towards preventing and responding to gender-based violence, violence against women, ending harmful practices such as early, forced and child marriages and teenage pregnancies. Right. The other bigger area that we work is on population dynamics, if I have to explain it in simple words. It's about how population data is used to design programs, is used to come up with policies, and also how that information is used to implement and monitor programs. Just to make sure that nobody is left behind. And then all the programs and policies are evidence-based, and it's based on population data. Yeah. We have presence in about 150 countries. That is almost 80% of the population. Yeah. We also are engaged in a lot of humanitarian assistance. It is to help women and girls in difficult situations, whether it's a crisis, whether it's a disaster, whether it's a pandemic, a war situation, providing safe birthing supplies, dignity kits, making sure that women get all these supplies. Right. So in short, fundamentally, we work on areas which are sensitive and very private, but which has a big impact on the public outcomes, whether it's on dignity of women, whether it's on equality, whether it's on equity and transforming societies.
You referred to certain stakeholders that you work with, and Dr. Sunita, you said FOGSI. Tell us, what is that?
FOGSI is one of the fantastic organization of OBGYNs. This federation is from last 75 years and I am a 63rd president of it. Our foundation, of course, it the huge work done by our previous presidents. So it's a very systemic organization which works on a maternal and woman health, and from adolescent, reproductive, perimenopausal, postmenopausal age group. So from the menses to the last day of your life, we are as a OBGYN work for the woman 24/7. So tell me, which is the profession where 24/7 uncontrolled emergency goes on? Lady can come in a labor at 2 a.m.
Yes.
I might have finished at 1 a.m.
Yeah.
I'm back to work at 2 a.m. But apart from my this organization, we run many programs. As she said, United Nations, their program, their policies, there are many goals we have to achieve. For example, UN has put up the goal of by 2030, the maternal mortality to come below 70. If you want to be in that group, your country need to be there. And we are working very closely with the government. We are talking about Swastha Nari Samruddha Vatan. That's my theme of the year. So, if government has a pressure of reducing the mortality, improving the maternal health, neonatal health, it is the we gynecologist has to work.
Ji.
So we work in hand collaboration with it.
So what is the mortality rate at the moment?
India is the only country, you should say, on a global platform. We were 500 plus 4 decades ago. Beautiful policies worked by the government, but also by our federations and the work of the doctors along with the public. We have come down to now 80. It's fantastic. And the decrease is by 86%, while the global decrease in last 4 decade is by 46%.
Right.
So the graph of India, it's anyone should follow, any developing country should follow. And I should say, Kerala, the maternal mortality has gone below 20. Probably it's helping us to overall make it below 80.
Ji.
But we have to reach in 5 years below 70, and we are running many projects for this.
Ji. Dr. Deepa, you said, that contraception goes way beyond preventing pregnancies. And you referred to equality, you referred to empowerment, you referred to lots of things that makes us think. So can you tell us a little bit more about that?
Girls and women are able to complete their education, get into the labor force or workforce, stay there, become financially independent. They are not just transforming their own lives. It's their family, it's their society and the country. What we are saying is the reality is not that. A lot of girls, especially young girls, are not able to access contraception. The situation varies different. The country is so diverse. Our adolescent birth rate is still higher, especially compared to even the neighboring countries. It's around 14 per 1,000 girls. So if you have 1,000 girls between 15 to 19 years, 14 have given birth. So the adolescent birth rate is that high. Although if you see overall the fertility is coming down, women are having fewer children, but there are these groups and geographies where this is still a major issue. So if women are able to know what is good for them and they are supported, the major challenge now what we see is the social norms, which actually prevents women and girls to access contraception in a way they want. I'm not talking about the educated, the literate, the employed women. There are vast women in the rural areas who don't have access to information, or they know that contraceptive is available, but they are not able to access it because of the standing social norms. Say, for instance, if a girl is married, they expect her to have a baby the same year, irrespective of or what age.
Absolutely.
She's not getting time to understand. Both she and her husband are not able to plan. There's so much pressure. That's the challenge. So in fact, if you look at our program, the National Family Planning Program, it's one of the largest, I would say. And, they have tried out everything. From providing a basket of choices to working on addressing the social norms. They have something called Saas Bahu Sammelans.
Right.
And now it's Saas Bahu's Pati Sammelans.
Right.
So where it's a community dialogue, they bring in mother-in-law, the daughter-in-law, and then there's the health worker. They facilitate, they clarify, whatever queries they have, they help them address myths and misconceptions. So all the efforts are going in. But the biggest barrier still continues to be the negative social norms
Right.
and the power inequalities.
Right.
It's always the man of the house who's deciding, or the family, the extended family is deciding for her. So that's the challenge that is being faced.
I think
by
that's
her.
why it is nice to bring in the entire family when it comes to family planning, but people perhaps should be recognizing that it is her choice.
Absolutely.
And it is her body.
Yeah.
And Dr. Sunita, I know that you must be working with and meeting so many women. What are the challenges when it comes to family planning for them, especially with regards to preconception care and getting enough adequate time, for example, between having babies?
Actually, Deepa has explained it beautifully. The girl has, many part of our country, she don't have a freedom to decide. And I think organizations like UNFPA are working hard to give her a freedom, give her a right. And my another concept of this is use the family planning methods so that your pregnancy is not an accident. Our concept is every pregnancy should be planned.
Right.
You just spoke about every pregnancy should be, you use some other word. It's not planned, but safe pregnancy is something you spoke. But every pregnancy should be a planned pregnancy. Now, what do you mean by plan? At present, what happens, the lady is pregnant and then she goes to the doctor. They find her hemoglobin is very low, and then we start, because window of opportunity is very narrow. In 4 months you have to make her body suddenly normal. Her weight, her blood pressure, her sugars, her hemoglobin, everything. And forget about her physical health, her mental health also. In no time she's shocked that she's pregnant because she never used contraception.
Right.
So our Sampurna is preconceptional care. Every pregnancy has to be a planned pregnancy. The lady should be knowing that her physical and mental health is fit to carry the pregnancy. So I just try to understand. If you want to go abroad, do you book your ticket? Do you ensure your visa? Do you see who is coming to pick you up and all?
Absolutely.
Here, though, you are carrying a 9 months journey with the baby as an end result.
Right.
And you are not bothered only this engine is fit or not.
Right.
Simple thing of taking folic acid 3 months prior. That will prevent so many problems with the baby. Neural tube defect, autism. It's completely preventable by just taking folic acid.
Proper nutrition.
But unfortunately, I would say that pregnancy, unplanned or planned, is only for one socio-economic strata. I do have a good class of patient coming. Sunita, missed the period. It was not planned, yaar. It just happened. We are not only improving our maternal and neonatal mortalities, but we are probably 3 decades down the line, most intelligent population will be in this country.
I do like the idea of a woman having the power to decide, and every pregnancy, as you said, being planned is wonderful. I wanted to ask, because you said it's not just a certain socioeconomic class or a section of people, urban, rural. What are the trends, Dr. Deepa, when it comes to contraception, family planning? You said in rural areas, adolescent pregnancies. I know when it comes to a city like Mumbai, for example, people are struggling with fertility now because they've pushed having children and they would like to have children later, but now they are not being able to have children. So it's about having children when you want to at the right time. So what are the trends, urban, rural, in India?
So I must tell you the story of India for this. So India's seen progress in terms of the fertility, how the fertility has been managed, but it's also a contrast. If you look at the average figure, what we refer to as the fertility rate. So in demographic terms, it is the number of children that would be born to a woman if she is having the current fertility rates. So it's come down to about 2. So in the 1970s, you would remember our grandmothers or grandmothers, they would have at least 5 children. So 70s, there were 5 children, and now it's come down to 2, which is below the replacement level. So the replacement level fertility is taken as 2.1, which is the number required for exactly replacing the population. So we are a little lower than that. But if you look at the urban-rural data, in urban areas, our fertility is 1.6, much lower than 2.1. And in rural areas, it's about 2.1. And we have certain states like Bihar, Meghalaya, the fertility is still 3. So in a country like India, it's quite diverse, urban, rural, even within the urban areas, you have the urban poor slum areas where the fertility could differ. So the point here is it's not about high fertility or low fertility. It is about whether the fertility intentions have been realized. I wanted to have a child. Was I able to? I didn't plan my pregnancy. Suddenly I'm pregnant. So it's about how do we handle this? How do we manage that? I think this is the next big challenge. It's not about bringing down fertility or increasing fertility. On both sides. So if you look at what is the infertility rates in India, it's about 1 in 10 couples. At some point of time, they face infertility. It's that high. On the other hand, even the unmet need is that high. It's 1 in 10. So 1 in 10 women in the reproductive age who does not want to have a baby or does not plan to become pregnant is not using a contraceptive. And that translates to huge numbers in a country like India. So the whole scenario is such that we need to address these issues.
But still, I think there's a long way to go. It's still very much a taboo subject. I wanted to ask you, Dr. Sunita, with your experience, do you feel that this generation, whatever letter this generation is, are they less averse to having these conversations?
I don't think so.
No.
I think it's a reverse way.
Really?
Yeah. And this generation is very smart. Before it was only the Google feeding them the knowledge. Now it is the AI also. And they come with everything.
I want to come to the options that are available. And because you said also that there are so many, there's so much misinformation out there. So of course, the number one thing is that you must go to a proper doctor. You must go to your gynecologist when it comes to family planning, when it comes to protection, when it comes to things like that. But tell us, Dr. Deepa, what is our basket of choices? What are the options that are available? It might sound like an obvious question, but if you could just spell out for us.
So, Soha, now we have a very good basket. So I'm talking about what's available in the public health system, meaning in the government facilities. Few decades ago, in 60s, we only had 3 contraceptives. And India was the first country to have its national family planning program.
The first 3 were the condom?
Condom, oral pills and sterilization. So, and in 70s, we had the copper IUD, which came in. Although we had the first national family planning program in the world, but, the entire emphasis was on sterilization. It was like, you complete your family and then you go in for this. And then slowly we saw the program evolving. Currently, we have about 6 to 7 methods, which includes condoms, oral pills, injectables. Injectables, you have IM, intramuscular, as well as subcutaneous. Like how they take insulin for diabetes. Under the skin. Then you have implants. Implants is the latest entrant.
Which,
no, it is subdermal. So they insert it, it's introduced in a few states, and in the private sector, it's just picking up. So it's just placed below the skin on an arm. So, and this is protective for about 3 years. So it's the first implant which is introduced in the country. And then we also have a non-hormonal pill, which is a weekly pill. It's called Chaya. It's like, it's an indigenous product from India. So you have all of it. And of course, copper IUD, you have a 3 years, you have a 5 years, 10 years, then you have the hormonal. So you have everything. The basket is...
In contraception, we have a variety.
Found
out that in contraception, once upon when we used to have very high levels of estrogens. So we came down to the level of estrogen in such a way that it is preventing your ovulation, but it is safe also. So we call it as a low dose pills, then only progesterone pills for lactating women. So even in contraception,
you have, you have variety. Like as in condoms, you have variety. So you have, you have a good basket in the country. And it's available free of cost. So while they go to Sunita, maybe they may charge. They will charge. Whereas in the government facilities, you have it all. And they also, in the government program, there's also something called the home delivery of contraceptives, meaning ASHA, or the accredited social health activist who works in the community, can also deliver contraceptives to your house. So it's that level.
What she said, Soha, since your podcasts are always well heard and reaches, I need to tell the people, all the time they blame government. The amount of work government has done in a public sector. There are ASHA workers, Anganwadi workers, our digital networking. Even it is very difficult for international, any UK or US organization to work the way Asha worker. She has been given 1,000 families. She knows everywhere about this family. Now any program, even my preconceptional care, why I want government to work? Because Asha worker can pinpoint the houses where already 3 kids, sterilization, she delete those houses.
Right.
Where there has happened recent marriages or only one child is there. When she knows there will be, she can pick up only those houses. It will be so easy for a government today to implement this plan because of these ASHA workers, the way they work for a maternal health.
Yeah.
When she said they can go home and deliver the contraception.
Right.
They do so much
At a grassroots level.
And look at our population.
Yes, I know.
So
It's a lot of people.
Yeah. So even if there is, of course, there are many private stakeholders and Japaigo type other implementation partners who help the government and who help to us also to reach out to these with the digital networking. Fantastic it is.
I want to ask, because we were talking about the basket of choices, but when it comes to contraceptions, people have lots of ideas in their heads, and a lot of them might be myths. So could you maybe dispel some of those for people who are listening right now? People think about weight gain when it comes to the oral pill. People think it comes to infections when it comes to the copper IUI, or the pain associated with heavy bleeding. What about women who have issues like PCOD or endometriosis? So if you could tell us a little bit about some of the myths associated with these contraceptives.
Yeah, so Dr. Sunita was mentioning how people now access all the information and then come. But what I've observed, although the information is abundant, the myths and misconceptions continue to be there.
Right.
So the moot question is, where are they accessing information? Is it authentic? Is it accurate? Is it complete? Especially with the younger generation. We keep hearing the same old misconception and myths. We do a lot of work with young people, especially on their sexual reproductive health. We have the life skills education, comprehensive sexuality education. So, we continue to hear such interesting, myths and misconceptions they have. Say, for instance, a lot of girls believe the first time they have sexual activity, they can't get pregnant. The copper IUD or an intrauterine device, that's with a lot of women, they feel that, it can get misplaced and it can migrate into different parts. It can even go into the heart,
right.
And there's also this belief that after a sexual intercourse, which is unprotected, they can pop up, say, painkillers and antibiotics in high doses, and that can prevent pregnancy. So they are getting some information which is not correct, which is not complete. And this is leading to a lot of risk-taking behavior, because of half-baked knowledge.
Right.
But the challenge is also the large majority of young women and girls who don't have access to an internet or a mobile phone.
Yes.
So in a country like India, maybe only 50% of the rural areas are able to access. And that's even lower when it comes to young girls and young women. Yeah. And there's this whole idea behind, if they are having access to this, they can get into risky behaviors. They can become promiscuous.
Sure.
All of that is kind of building up. And the myths and misconceptions continue to grow. And there are also several initiatives. Say, for example, UNFPA, we've launched a chatbot. It's called Just Ask or Khulke Pucho. It's in Hindi and English and a mix. So, people can post any question or query they have on anything growing up. Say, I've missed my periods, I've had an sexual debut with someone, or, I'm mentally not feeling really good. So it can be anything. Right. So it's, then when they post these questions, they get responses. It's not just providing information. It's also connecting to services. As Dr. Sunita mentioned, they try out everything. And then, they are in a panicky situation.
Yes.
So just to prevent them to going to that extent,
yes.
Things like this can help. But again, we need to look at what is the reach in a country with so diverse, and such challenging conditions, how do we make sure everyone has correct age-appropriate information? What could be the pathway? What could be the channels? What could be the sources?
But that is exactly my next question, is what is the solution? How do we make sure that people, especially this young generation, is getting access to the right information?
So that is where the role of we doctors come.
Yeah.
And the organization like UNFPA and all help us to spread the knowledge. They have to take it from the doctors. Initially, I'm not saying ki contraception every monthly you visit the doctors.
Right.
First go visit the doctor, gynecologist, whichever place you are, and just say that I want to start the contraception. Let gynecologist decide which contraception is good for you. When you are talking about the myths, 3 monthly injections are really very simple, Soha. It's so easy, but people are not using it. I don't know why it is not so popular. Then daily popping up the tablet.
Right.
Because they are not confident that one injection in 3 months will protect me. By popping up the tablet every day, they feel, oh, I'm doing something. So
it's too convenient. There must be some jol.
Yeah. So it's very, very important that they should have authentic information from the medical fraternity.
Right.
If I can add on
Of
to
course,
it.
please.
So, we also need to think in terms of how many people can keep going to the doctors. So what are the other mechanisms?
Right.
So a lot of countries, they have something called the comprehensive sexuality education that is provided to adolescents and young people starting off from schools. There have been some initiatives, even in India, for example, they have the Rashtriya Kishore Swasthya Karikram, the National Adolescent Health Programs, where they have set up adolescent health clinics. Then they are training peer educators. There's a program through schools called the Ayushman Bharat School Health and Wellness Program, which UNFPA and a lot of partners support. And there are also state-specific initiatives, which is also trying to bring in comprehensive sexuality education. But we are not there yet. And of late, you must have seen there are a couple of PILs, public interest litigation, asking for integration of comprehensive sexuality education into schools.
Yes.
So that's being examined. So I think to answer to your question, how do we address this? I think we need to have multiple ways of addressing this. It's not one size can fit all. Maybe through digital media applications which can reach out to young people who are very active on their social media. It could be through schools, it could be through healthcare providers. And within this, the big challenge is the biasness and the judgmental attitude of who's imparting it.
Yes.
Even if someone goes to a doctor, they can be, okay, she's unmarried, why is she asking about contraceptions? They will get into morally advising her and telling her, abstinence is the best and you shouldn't get into it. And she's not getting what she wants.
We want judgment-free.
Yeah, judgment-free. So there's a lot of efforts going into orient and sensitize doctors and other counselors and healthcare providers on youth-responsive services.
Right.
Saying that, we should not get biased and we should not bring in our social fabric and what is expected to. That's the big challenge. See, if you see, there are programs, whether it's of the government, whether it's of the FOGSI, of all the agencies, UNFPA and others are working on. But we are not able to kind of overcome this issue on, for example, if a teacher has to transact a session, she's not going to talk about all of the issues that is in the minds of young people. A healthcare provider in a village is going to speak or she's going to provide contraceptives. Obviously, she's not going to give it to a girl who's not married.
Right.
So the big challenge is in addressing all of this. And I think everybody is putting their efforts together. So it'll be some time when we can actually...
Yes. We had one conversation on sex education where the sex educator said she in fact went into a school and there was a anonymous box where you could put your questions. And so people then don't feel like, okay, I'm putting up my hand in front of everyone.
Yeah.
You can put your questions in anonymously and then those are read out.
Yeah.
But I just want to ask, why is this conversation still so taboo? Because I feel like if you normalize these conversations, then one can actually put a system in place whereby doctors, the right information can be given to children, schools, young adults. So in your experience, why do you feel that it's still so taboo?
What global evidence is same. So there's this belief or a misconception saying that, if you provide sexuality education, the young people can become promiscuous.
You're
start
putting
their
something in their head that wasn't there.
Yeah, they can get into experimentation, sexual debut at a very early age. There was a study which was done across 80 countries, and it showed that it was never the case.
Right.
They were not getting into risky behaviors. They knew what to do. Adolescent pregnancies were coming down. Right. So that's something which we need to accept.
Right.
You know, and
I think adolescent pregnancies were coming down because they were started using contraceptions.
Yeah, could be.
Very important.
Would be. And it's not just a phenomenon of urban areas, rural areas also, 7th, 8th, not 9th, 10th, you know, at much younger age. And it was always there perhaps. You know, it never came out, or the media didn't bring it out, or, you know, those were not seen.
Right.
So it's always been there. It's not that, you know, because of information they are getting into experimentation and they are.
Right.
But they are also getting into a little risky behavior because they don't have the complete information.
Right, exactly.
You know, emergency contraceptive pills or morning after pills or eye pill, you know.
So how to protect
how to
themselves.
protect them. So that's the current issue.
How affordable and accessible are contraceptions?
For me, if I say, because we work exclusively with the government, and we've been also helping government to procure contraceptives for the country, it's completely free. Right. And India is one country which has done really well. It's always free. In fact, you know, women get compensated for the loss of wages. If she's coming to get her sterilization done, or if she's coming to get a copper IUD or an IUCD injected, she gets paid.
But otherwise,
So
also
completely
these are expensive medicines.
Right.
Whether oral contraceptions or not. See, every girl, she carries the iPhone or the good Android and other phones, right? Compared to them, the cost of this contraception is peanut. 3 monthly injections, they are so affordable. So it's not that the contraceptions are expensive.
I have to ask Dr. Sunita, the conversations that happen around contraceptions, the onus tends to be on the woman. It is her body, it is her responsibility, therefore, to not get pregnant. Are we getting any close to expanding that conversation, sharing that responsibility?
You know what? In my practice, if I say so, very difficult, not only the male partner to accept the barrier contraceptive, the condoms, most easy way, she don't have to pop up every day. They have to use only when they are having an act. But the problem is barrier contraceptive has its own higher failure rate because they don't use it every time. They use it only during that peri-ovulatory period, which may not be predicted 100%. Right. Number one. Number two, when a couple comes and when I'm advising, the lady itself refuses. No. Why my husband will use the condom? I'm ready to use it. I'm ready to pop up the tablet.
But that is
ready
conditioning over
centuries. Yes, that has to change. Even when a permanent sterilization comes, there are gynecologists who have done vasectomy.
Yes.
Just to prove that the power doesn't decrease, the sexual desire doesn't decrease. You can climb up the hill even after the vasectomy. But today, if you see tubectomy versus vasectomy, the incidence of vasectomy is so low.
Right.
For tubectomy, we have to enter in your abdomen.
Right.
We are
so invasive.
Well, vasectomy, it is just the under local anesthesia OPD basis procedure.
Right.
Devoid of any complication.
But as you said,
will change.
It will change. And I think conversations around this, and you telling perhaps men that, you know, it's not going to affect their
this
masculinity.
And these hormonal pills, when a lady is popping up, these are hormones ultimately. It is going to affect her. Why not to use the condom, non-invasive barrier contraception? Easy. And as she says, variety of flavor.
And also the thing is, like, you know, the whole research and the scientific advancements and, you know, how it has shaped up, it's always putting the burden on women, especially with respect to contraception. Whereas research in all the other areas, there would be on men. But when it comes to contraception, for men, you have only two methods, as Dr. Sunita was explaining. Either you go in for a vasectomy, which is a permanent method, or it's condoms. For women, you have a variety. And then, like, you know, by design, it is like, it's the women's responsibility.
The onus is on you.
Yeah, but that's changing slowly.
And I believe there's also some research being done on the male contraceptive.
Yeah, there is. It's going on, and they're looking at a monthly pill, a non-hormonal one. again. And I think a hormonal one also.
I don't
and some are
think it
at
will become so popular.
Yeah.
Let me tell
the
you.
thing is, like,
It's not.
It's not now. Even in the past, there has been some research that has gone into coming up with implants for men, for example, and several others. But it never finally comes into the market, or it's never there in the program. So we need to wait for some more time, I hope, and I hope we will have more choice for men.
We'll have.
And men do really want to be part of it. It's not that no men want to get into
No,
contraception.
pharma industry will be flourishing with that male hormonal pills, and that's the reason it will never come up.
It's not a money-making business immediately.
And there was a study which was done across US and Canada where they asked men, if they had options, would they? They said yes.
Yeah.
Surprisingly, 75% of the respondents said yes, they would want to use contraceptives if they had.
Has anyone asked the Indian man this question?
I don't know. I think we should start.
No.
You can ask them. Are you ready to take responsibility?
Yeah.
And be mindful in family planning?
Let them give a comments.
Yeah, let us give it in the comments. Are there any advancements happening in general in contraception? Any more modern contraceptives?
These implants,
available? These implants, subcutaneous implants, I wasn't aware.
Implants is one, and I think there's more research going on. So, for example, the injectables, which Dr. Sunita was explaining, it's a 3-monthly injection.
Yes.
They're now trying to make it a 6-monthly. And then,
this is also free or available at a...
They are available. It's less than a coffee at a Starbucks. I totally agree.
Okay.
These 3-monthly injections are very cheap. And we not only use it for contraception, perimenopausal age, she's bleeding profusely, uterus is normal, no pathology, she has just the hormonal imbalance. We put her on these 3-monthly for 2 years, 3 years. No need of removal of the uterus.
And the side effects like weight gain?
Nothing. So, yeah, there may be minimal. But if one is cautious about daily routine of exercises, sweat out, there is not such a massive contraindications or a complications with it. It's very simple. You are avoiding one surgery.
You're absolutely right. I feel like, the narrative in India when it comes to contraception, when it comes to family planning, it tends to generally be on limiting your family size. You have hum do hamare do. Do you think, either of you, that perhaps we need to change that narrative more and maybe reframe it and talk about building healthier relationships, healthier bodies, empowerment, choice? Things like that should come into the vocabulary.
see, at the macro level, there's always this discussion about how many children is a family having and what is its impact on the fertility of the country. Are we increasing in numbers? Are we decreasing? Some countries have this challenge. I think that should go. See, for a couple, it is how they want their family to be. So when they are able to sit down and discuss and plan their children, they are trying to shape their future, their family. I think that should be left to them. And they should have the means, they should have the information to responsibly decide. It shouldn't be the state or it shouldn't be a program setting a target for them. I think it's changing and it will change. And we see that in India, it's changed. So I think that would be my take on that.
Could you tell us a little bit about UNFPA's success stories? You've spent so much time on the field, on the ground, in terms of how contraceptives have perhaps changed the lives of women, families that you've come across.
We've been in India for about 50 years and family planning is a big program that we've been supporting. I can tell you some stories from the field. So there's this family in Sheikhpura district of Bihar. It's a story of 3 generations. So the grandmother, she had about 5 or 6 children and she was married very young, 14, 15 years. She had no clue about contraception. She didn't even know that women had that choice, to decide not to have children. Her daughter-in-law, her son's wife, she didn't want to have so many children, but she was not allowed because, there was a lot of pressure that she has to bear children and she ended up having 6 children. Her daughter, the third in the generation now, 26 years old, she's got 2 children, both daughters. And then we covered her story. She says, I wanted only 2 children. I need time for myself. I need to take care of my health. And I want to bring up my children in a way that they are healthy, educate them. So this is in a remote rural. So that's the story in India, what we are seeing. And we feel really good about it. We've been able to contribute a lot about it.
Right.
Another story, if I could share quickly. This interesting couple in Orissa. This girl is about 20 years of age and she's working in a primary school. She was married for a year and there's a lot of pressure. Oh, why aren't they having a baby? And, every other day she's being asked and, forced. Her sister-in-law is asking, mother-in-law is asking. But her husband stood by her. He's a mechanic at a local shop. And what she was saying is they would go to the nearest community health center, get the injections every 3 months. She said, I was able to do this because my husband stood by me.
Right.
And I want a space. I want some time for me because I want to complete my bachelor's in education, get a good job. So then I can also get maternity leave. See, now if I become pregnant, I would just be out of my job. So stories are changing.
Yes.
And it's really good when you go out to the field and see what's changing.
Feeling good, yeah.
I feel absolutely. You have every.
Yes.
Just last couple of questions I wanted to ask, looking ahead. What do you think is one change that we need to see in India such that people will have safe and easy access, equitable access to contraception? First, you, Dr. Deepa.
It's a difficult question. We've talked a lot about addressing social norms. So one big barrier which I continue to see across is the negative social norms and the, unequal gender power relations. So if we could do something about it, that's going to change the whole scenario.
Yes.
That's something. The other thing you asked me also about in terms of the programming.
Yes.
What can we do? I think it's time that we look at innovations now. How do we empower women better so that they are able to take charge of their lives? See, for everything, other than pills and condoms, they have to go to a health facility and get maybe the injections also. So now you have the subcutaneous injectables and nearly 55 countries, they have now allowed it for self-administration. Like how
you can take it home and
you can administer, you can even take doses for this. Things like that. It's time that we start looking at what are the next level of innovations that we can bring in so that the access becomes much easier. Otherwise, the whole program has evolved to just providing services to addressing all the other issues of social norms and etc. And as Dr. Sunita is saying, India stands at the forefront. When I attend some of these conferences and share what India is doing, or when we hear, there's a lot of interest, especially on things like Saas Bahu Sammelan. We also have another interesting intervention, which is distribution of Nai Pehel kits. So it's given to newly married. It has condoms, it has oral contraceptives and some make-up items which the Asha goes and gives as a gift.
It's a good present.
Good present. So which is also trying to break this myth that, once you're married, the same year you need to have a child or have a baby. So there's a lot of this, but what are the other innovations that we can bring in is something that we need to
Dr. Sunita, do you watch Bollywood films?
Yeah, sometimes.
Is there one myth from sort of Bollywood culture, which we realize has an influence on people's mindsets, that you would like to maybe pop?
I definitely feel that the impact of Bollywood is huge.
Yes.
When we talk about, sanitary pads, for example, when Akshay Kumar started talking, no one was feeling shy about talking about sanitary pads. So, I always felt that even when I'm meeting the ministry, I'm telling them, when Narendra Modi says in a COVID pandemic, aap thali bajao, to Ratan Tata se Amitabh Bachchan, everyone did that. So if every pregnancy should be a planned pregnancy, everyone should be aware of contraception, the male and female contraception, what are the newer contraception, no one has a knowledge about them. As you said, implants, you were not aware.
No.
There are disadvantages, there are advantages. You don't have to take daily, but you have an uncontrolled release of the drug, So you need to be educated about it. But if someone from the film industry who influences the masses speak a volume about it, it will be. I'm always telling her, I just wish Narendra Modi announces this one day. Maybe he'll listen to this podcast and he will accept and he will call us.
What would you like him to say?
Every pregnancy in India should be a planned pregnancy. You just imagine what change the world will look at India in a positive direction, because today we are with the high maternal mortality. Tomorrow we are the people who will be followed by others.
Just closing comments from the both of you. Dr. Deepa, first you. If there is one message that you would like to impart to anybody listening, today's youth, regarding contraception and family planning, what would you like to say?
So I would say your reproductive health is your power. Own it, protect it, and plan for it. Don't blame others. I think that's the message I want to leave.
And take responsibility.
Yeah, take responsibility.
And you, Dr. Sunita?
I would like to say, look at the contraception, that it is empowering your health, it is protecting you, and feel that empowerment also has come with the choice of your contraception. When we talk about the woman empowerment, we talk about so many other factors. Choosing the right contraception itself is a woman empowerment. Think that you are empowered, because if my body is not fit, I'm not going to take this. Very important for a lady to understand and know about it.
Thank you so much to the both of you, because I think it's a really crucial conversation to have, and I hope that people have been listening and understand the implications.
I'm listening to your so many podcasts. I'm so happy about all about her. Sure, you must be doing a lot of study by yourself.
Little bit. I mean, I have to ask the questions. I'm not the expert. You guys are the experts. But I'm interested, and I think I've definitely learned a lot, and I'm sure that anyone listening has as well. So thank you both for all your time, and thank you for all the wonderful work that you're doing.
Thank you so much, Soha, for having us
And I
on
would
your
like
show.
to thank UNFPA for arranging such a wonderful program.
Not at all.
Absolutely.
It's a pleasure to be on your show.
Today's conversation has highlighted something very important. Access to contraception and reproductive health. It isn't just a personal choice. It's a matter of empowerment. It's a matter of equality and well-being for women, for couples, and for society at large. I do want to thank our incredible guests, Dr. Sunita and Dr. Deepa, for sharing their expertise, for sharing their insights and their stories from the field. And I do want to thank UNFPA India for their unwavering work in ensuring that every individual has knowledge and the tools to make informed decisions. If you found this episode helpful, please do not forget to like, to share, and to subscribe to All About Her so that you never miss an important conversation. Until next time, stay informed, stay healthy, and we will see you in the next episode.